Sure. That's great. Well, good morning, everyone. Here we are again today. I'm joined by my colleague, François Legault, the Premier of Quebec. And I'll just start off with a few comments in English, and I'll ask Monsieur Legault to respond in French as well. So obviously looking forward to our meeting with the Prime Minister today. As I mentioned yesterday, it's a positive first step that we see. Moving forward, I think all Canadians are expecting us as political leaders to have these welcoming discussions about the future of our healthcare system in our country. As I mentioned yesterday, and as the Prime Minister has stated as well, we don't expect a deal to be there today, but we are looking forward to sitting down and seeing what the proposal is of the federal government. So obviously we want to ensure that we are providing for a sustainable future of healthcare, a sustainable funding model for our healthcare system. So we're very much looking forward to seeing that. So again, today is the first time that we will, as premiers, be awarded the opportunity to see what that proposal looks like. And so we look forward to seeing that. And so I'll hand it over to Monsieur Legault.
Thank you, Heather. So I'm happy. Non, je vais y aller en français, moi. Donc, je suis très content d'être ici à Ottawa avec les premiers ministres des autres provinces et des territoires. Comme vous le savez, ça fait 2 ans et demi qu'on demande à Justin Trudeau une rencontre pour discuter du financement de la santé. Donc, déjà qu'on ait cette rencontre, c'est un pas dans la bonne direction. Comme vous le savez, notre demande est restée la même depuis le début. On demande d'augmenter la contribution du gouvernement fédéral de 22% des dépenses en santé à 35% des dépenses en santé. On demande à ce que ce financement additionnel soit donné sans condition. Pourquoi? Parce que ce sont les provinces et les territoires qui connaissent le mieux les priorités en santé et c'est un champ de compétences qui relève des provinces et des territoires. On demande aussi une indexation de 5% minimum par année. Pourquoi? Parce que la santé, c'est la seule dépense des gouvernements qui augmente aussi rapidement à cause des impacts du vieillissement. Donc, on demande un ajustement qui soit à chaque année de 5%. On veut donc répondre à la demande qui est énorme pour des services de santé, puis on pense que le gouvernement doit faire sa juste part, puis 22%, ce n'est pas suffisant. Donc, tous les premiers ministres sont ici aujourd'hui, ouverts, de bonne foi, et ce qu'on veut, c'est de travailler pour les citoyens. Merci.
Chris Rand, CBC. I asked this question to both of you because right now hundreds of thousands of people are seeking medical care in St. Boniface on a gurney, trying to get into the mega hospital in the CHUM in Montreal. What do they get out of today's talks? When does their health care get better? Could you just explain it to the real average day Canadians who are suffering right now, please?
Thanks very much for the question. I'll start off and hand it over to François. But of course, you know, I think today is about listening and learning from the Prime Minister what his proposal is for the future of healthcare funding in our country. And I think what this will offer is hopefully an injection into the healthcare system moving forward to make sure that it's more sustainable for the future. So to those individuals that are out there seeking healthcare right now, we want to ensure, certainly from Manitoba's perspective, we'll continue to put together programming to ensure we do have our surgical and diagnostic backlog task force as well that's tackling some of those things. Obviously, some of the challenges out there are human resource challenges in the system as well. So those are things that will come, I think, from a more sustainable funding model into the future. And we look forward to having those discussions today as premiers and with the Prime Minister.
I do agree.
Bonjour, Christian Noël de Radio-Canada. Ma question sera pour M. Legault, peut-être Mme Stefanson, si vous voulez aussi répondre. On semble sentir un certain optimisme. Qu'est-ce que vous pourriez entendre cet après-midi en rencontrant M. Trudeau qui vous enlèverait cet optimisme-là?
Bien, écoutez, ce qu'on demande, c'est un montant substantiel, sans condition. Donc, si ça ne répondait pas à ces deux attentes, on serait déçus. Mais déjà, qu'il y ait une proposition sur la table. Puis même M. Trudeau a dit « Je ne m'attends pas aujourd'hui à avoir une entente ». Donc, on va prendre les prochains jours, parce qu'évidemment, on souhaite que ça soit dans le prochain budget fédéral des prochains mois et, par conséquent, aussi dans le budget des provinces et territoires du printemps. Donc, on va, pour l'instant, on n'a pas de plus d'informations, donc on va le savoir cet après-midi.
Et si vous me permettez, le 5 que vous avez mentionné, c'est la position juste du Québec ou du Conseil de la Fédération?
Non, du Conseil de la Fédération. Depuis le début, ce qu'on demande, c'est une augmentation substantielle du TCS et on demande que ça soit indexé à 5 plutôt qu'à 3 Ça a déjà été à 5-6 malheureusement, c'était réduit à 3 Puis oublions l'inflation exceptionnelle qu'on vit cette année. Dans une année normale, à cause des impacts du vieillissement, il y a plus de personnes à soigner à chaque année, puis la croissance de ce qu'on appelle les coûts de système est à 5 contrairement à d'autres dépenses où c'est 2-3
Bonjour, pour M. Legault aussi. On a vu sur la pancarte de votre candidat Victor Pelletier que vous allez vouloir miser pour la partielle sur des baisses d'impôts. Pensez-vous pas que ça peut nuire à vos négociations ici pendant que vous demandez de l'argent au fédéral?
Bon, ce qui est important de rappeler, c'est que les taux d'impôt au Québec sont plus élevés qu'ailleurs dans le reste du Canada et aux États-Unis. Vous savez, mon obsession, c'est d'éliminer notre écart de richesse avec le reste du Canada. Pour ça, il faut avoir des incitatifs, il faut être attractif. Puis actuellement, les taux d'impôt très élevés au Québec n'aident pas à éliminer cet écart de richesse avec le reste du Canada. Donc, je pense que ça n'a rien à voir. On va continuer, malgré les baisses d'impôts qu'on a promises, on va continuer d'avoir des impôts très élevés au Québec.
Bonjour, Monsieur Legault. So is your government prepared to hold up a healthcare funding deal agreement if the federal government doesn't agree to certain conditions? You're saying that you don't want conditions, but is that really realistic?
But it depends what you call conditions. So far, what Mr. Trudeau said is that he would ask us some data information. We already give these data to the population in Quebec, so I have no problem transferring those data to the federal government. Regarding targeted funds, if there is flexibility, if we can, in fact, apply the Dubé plan we have in Quebec and respect our priorities, I think that that's what is important for us, to be able to use the money the way we want to use it.
And this question is for Minister Stefanson. Earlier, your Newfoundland counterpart said he's confident a deal can be reached before Victoria Day. Do you share his optimism and his sentiment on an exact date?
I mean, this is something that we've been discussing now for over 2.5 years, and so we'll see. But I know that there is a willingness on, I think, everyone's part, and certainly on Canadians' part, to make sure that we work together to come to a resolution. And so I think we want to move in that direction. Obviously, today we'll be seeing what that proposal is. Again, the last 2.5 years, the federal government has seen what our proposal is, and we look forward to seeing their proposal today. And I think I'm optimistic that we can work together.
Bonjour, ma question est pour M. Legault. C'est Michel Sabat de la presse canadienne. Sur votre demande de 35 %, êtes-vous négociable?
Bien, écoutez, on pourrait avoir un premier pas dans la bonne direction. Donc, on est ouvert à un premier pas dans la bonne direction. Il y a un budget qui s'en vient. Donc, quand je parle à Éric Girard, ça serait bienvenu d'avoir un montant substantiel, même si ce n'est pas le montant total.
Qu'est-ce qui vous fait croire que le Front commun des provinces va tenir et comment ferez-vous pour qu'il tienne?
Bien, ça fait 2 ans et demi qu'on se parle puis qu'on se tient. Et on a un problème qui est commun, qui est le fait que dans toutes les provinces, c'est difficile de financer la santé à cause de la croissance de 5 % des besoins à chaque année. Donc, on a on fait face à la même réalité. Le gouvernement fédéral finance 22 %, les provinces et territoires financent 78 %, puis ce 78 %-là grandit continuellement. En fait, pour 22-23, c'est 79 %. Donc, il faut à un moment donné que le gouvernement fédéral fasse sa part, puis c'est un problème qui est le même dans toutes les provinces et territoires. Donc, ça n'a rien à voir avec d'autres sujets comme les valeurs, la langue. On parle vraiment des dépenses de santé.
Hi, Premier Stefanson, Stephanie Taylor with the Canadian Press. Hi. Help me understand what the Premier's position going into this meeting is on the 35% ask for the Canada Health Transfer. If that has been the singular ask of premiers for the past number of years, but now this morning we have premiers like Andrew Furey saying there's a sense of pragmatism and we're going in open-minded, so which is it?
So obviously we put that proposal on the table 2.5 years ago, and now we're seeing for the first time what the federal government is coming up with in the way of a proposal. And so I think, you know, many of my colleagues have said, and we've all said, we want to go in with an open mind. We want to see what it is that they come out with today. And, you know, we'll take it from there. I'm not going to predispose what is going to come out of that and what they are going to say. I know there's been various things in the media that we've seen, but we haven't seen anything yet. And so today is really about us being able to see what it is that the federal government is going to ask for. I think one of the things that we've been very consistent on all the way through this is to ensure that we have predictable and stable long-term funding put into the baseline of the Canada Health Transfer to ensure, again, that predictable, stable, long-term funding for Canadians.
So as a follow-up, if it's not 35%, and I understand you haven't seen the deal yet, what is that line in the sand for you? How do you define right now what stable, predictable, long-term funding is?
I'm not going to start negotiating against ourselves here, but we know what our proposal is. We'll see what theirs is, and then we'll take it one step at a time moving forward.
Marcia McLeod with the Globe and Mail. This is for Premier Legault. Just to ask in English, what is your stance, your current stance on whether you will accept conditions from the federal government?
On what? On
conditions from the federal government. What's your current position?
We don't want conditions. What we want is to be able to apply our plan. We already have a plan for healthcare in Quebec, and we need more financing from the federal government. Like I said in French, we're open to share data. We already share data with the population, so I have no problem giving these data to the federal government. And if they want us, because we all have the same priorities about family doctors, about long-term care, so if we have the flexibility and with the federal money be able to finance what we want to finance, be happy.
Thank you. Just as a follow-up, how do you understand what would be presented today from the government? Do you see that this is a final offer, or do you think that there'll be room to negotiate on the cash that's being offered?
To me?
For Mr. Legault as well.
Bon.
Apologies.
Mr. Trudeau had 2.5 years to present a proposal, so I guess we would have a few days to study it.
And we have 2 hours.
We've got time for 2 more questions, folks. Good morning. My question will be to both premiers. I want to ask about mental health funding. The Liberals promised a mental health transfer in the 2021 election. I'd like to ask both of you. Have your governments had preliminary conversations about that? And secondly, if the CHT gets wrapped up as there's a final deal and you guys finalize that, are both of your governments open to having serious conversations about a separate mental health transfer?
Well, again, I think today is really about listening to what the federal government is going to be offering us in terms of a long-term sustainability to healthcare funding across the board, and that includes mental health and addictions challenges that we're facing even more now as a result of the pandemic. But certainly, we recognize, certainly in Manitoba, we recognize the importance of the challenges around mental health and addictions, and we are looking at ways to address those challenges as well. And certainly, if the federal government wants to come to the table and help as a part of that, we're very open to having those discussions.
Premier Legault, are you open to a transfer specifically for mental health and only mental health?
Mental health is a priority in Quebec. So if the federal money respect our plan on how much we want to invest in mental health, I have no problem with that.
Bonjour, cette question est pour vous, Monsieur Legault. Il y a une lettre qui a été signée par 200 personnes demandant encore le départ de Mme El-Gawabi.
Je vais vous arrêter tout de suite. Là, par respect pour tout le monde, là, je vais juste répondre aux questions concernant les transferts en santé. On aura une autre occasion de répondre sur les autres sujets.
Ouais.
Regardez ça avec Evan.
Parfait. Et sinon, sur Roxham Road, justement, on a entendu... Non? OK.
We're done? Thank you very much, everyone.
Okay.
Have a great day. I'm sure we'll see you